Oftentimes, when an individual is asked to recall an event from the past, they may reflect on a positive situation, reflecting on the positive memories rather than the negative ones. While this is not necessarily a negative thing, there may be an explanation. According to Johann Noberg from False Nostalgia, when things change too fast, we lose our sense of self-control. This is probably why yearning for the past is especially likely when we experience rapid transitions like maturing into adulthood, aging into retirement, dislocation, migration, or rapid technological advancement. Good morning, my name is Lennon Ham, and this is the manifestation of dissociative amnesia. Now, as I mentioned previously, people reflect on positive memories while having a disregard for traumatic events and things like that, which can be associated with dissociative amnesia. This leads me to my research question on how does dissociative amnesia affect the development of PTSD in individuals under the age of 18. Now, this can be exemplified through the answer to this question can be exemplified through the increased severity of PTSD as a result of dissociative amnesia and childhood maltreatment increasing the symptoms of PTSD through correlation with dissociation. As you can see, this graph from Li Wang compares different psychological symptom patterns within Chinese adolescents diagnosed with post-traumatic stress disorder. At the top, this yellow line represents complex PTSD, and it shows it in a dissociative subtype. As you can see, it has the highest probability out of all other subtypes and groups of PTSD, this ranging from about 0.7 to 0.9. It shows how dissociative amnesia enhances the severity of PTSD and overall makes it worse for children that are suffering with it. Now, we'll look at how childhood maltreatment has an impact on dissociative amnesia and things like that. So in the US, more than 550,000 children are known to be abused. And according to studies, participants experiencing PTSD and dissociative disorders, out of all of them, over 80% reported physical or sexual abuse throughout their childhood. Now, this leads me into dissociative amnesia being a possible symptom for PTSD. PTSD is a mental condition that occurs after a severely distressing event, and some symptoms may be changes in mood and intrusive memories and flashbacks. On the other hand, dissociative amnesia is the repression of memories. It's the brain's attempt to prevent the individual from experiencing harm after a traumatic event. And according to Sandra J., PTSD and dissociative amnesia have a relationship because the inability to remember an important aspect of a traumatic event is a common symptom shown in many PTSD patients. Now, some people may argue that the relationship between PTSD and dissociative amnesia is overemphasized, but this is not necessarily true. They also argue that it is beneficial to children suffering with PTSD because it may block the harmful memories that they're experiencing from their traumatic event. However, dissociative amnesia is a temporary relief. It's not always beneficial, and it can cause intense waves of emotion that randomly appear. According to Sophia Song, state-dependent memory is heavily evolved in research for both dissociative amnesia and PTSD. These traumatic memories are often formed in a condition of state-dependent learning, which causes the memories to be hidden until a similar trigger is experienced. This will lead to flashbacks of the traumatic memory when provoked. Now, what she's saying in this quote is that dissociative amnesia won't necessarily block out all of the harmful events or negative impacts from PTSD because flashbacks occur at random and they're very common in PTSD patients. And we can see this because there are different parts of the brain that are responsible for flashbacks, such as the cortex, the hippocampus, and the amygdala. And the cortex is for emotional regulation, the hippocampus is for memory consolidation, and the amygdala is responsible for emotional processing. All of these make up the part for flashbacks, and flashbacks are very common in PTSD patients, so it can't necessarily be prevented or stopped. Now, after we've explored the relationship between PTSD and dissociative amnesia, we've seen the impact that there is, and there are some solutions to this. According to the National Children's Alliance, there are evidence-based therapies that may help children struggling with dissociative amnesia and PTSD. As you can see, these therapies are cognitive therapy and hypnotherapy. As you can see in this graph, the red represents before treatment, and then this is kind of like an orange color, it's before treatment as well, and the blue is after treatment. As you can see, there's a significant decrease between PTSD before treatment and after treatment. This shows that after treatment there is no PTSD. So before there's 20% of people struggling with PTSD, and 8% of them had experienced no PTSD after the treatment. And it also shows how it's preventative because it shows the distress levels, which is about 12%, and it decreases to 6% people with no PTSD after. This isn't to say that there isn't limitations to this. Children may struggle to express their feelings during cognitive therapy because they're still developing and they may not understand their emotions fully or know how to describe them. And hypnotherapy is still being developed, which is why it's a limitation, because it may not be as effective as other therapies or treatments. Thank you.
All right, 2 questions for you, Lemon. Back one over. Perfect, there you go. Okay, now you're on film. What evidence did you gather that you didn't use, and then why did you choose not to use it?
Well, when I was looking for evidence, at first I was kind of finding some sources that said that there wasn't a correlation, so I didn't use it because I'm trying to find out the relationship between it. But I also found some that said that the relationship wasn't as strong, but then I found more sources that said that they had a stronger relationship, so I just didn't use the ones that talked about that, or the ones that talked about adulthood and PTSD in adulthood, because I want to focus on children.
Okay, and then what advice would you have for people that consider this pretty big topic in the future?
I would say to do more research on dissociative amnesia. I feel like my presentation, I felt like I focused on PTSD a lot, and I feel like there's more of a connection between PTSD and dissociative amnesia, deeper than what I explained.